Hi, this is Dr. Yates, and I wanted to go through a question I get asked at least 2 to 3 times a week. And the question is, Dr. Yates, I've been to your website, I've seen you in person, I see your medical credentials, but I want to know, just tell me, what's the deal? What's the difference between you and all the millions of hair transplant surgeons that I see now that are on the internet or on TV or in your town or so forth and so on? So, here's the answer. Number one, there are a lot of great hair transplant surgeons in the United States and abroad. So I'm in good company. That's number one. Now, number two, and the most important, what makes me different is, one, my name is on the door. It says Dr. Yates, diplomat of American Board of Hair Surgery, meaning that I've taken a test that shows that I have some proficiency in hair surgery. Now, I think that's important, number one, that somebody has taken that test to make sure that they are serious about the craft of hair surgery. So I think that is one credential that everybody should look for. If you're going to do hair surgery, you should be a student of the craft and have spent time to prove your proficiency. So that's number one. Number two, when you come in, my name's on the door, it says Dr. Yates, and who are you going to see when you come in the door? You're going to see me, Dr. Yates. You're not going to see any other doctor, any other trainee, or anybody else, my cousin, or anybody like that. You're going to see me. So why is this important? It's important because I've spent time mastering the craft, and I want to pass that along to you so you get the best care possible. Now, why does this make sense? Now, this makes sense because, say if you go in and you want to hear your favorite band play, and everybody has a favorite band, but then when they go in, they say, they see a band, they say, your favorite band's not here, but there's a band that was trained by the band, it's just as good, that band taught them all the tricks, and they're going to play for you. You would be like, no, I don't want to hear that band. I want to hear my favorite band. I want my band to play for me. So that analogy works here because I am doing your surgery. When you come in, you will see me, you are a patient, we'll come up with a diagnosis and a treatment plan, and I will be the one to implement both of these, not any trainee or anybody I've hired or anybody that I've showed how I do it. I'm going to do it myself, okay? And when you come in, I see every patient personally. We discuss what your expectations are, and I found that's the most important thing in a hair transplant is expectations. Everyone comes in with an idea of what they want, but it all comes down to what we can really achieve. And my happiest patients are patients that understand and realize what the real expectations are. So, you will see me, you won't see anybody but me. I will see you through the consultation. This is a medical practice, so it's not like an assembly line. You can stay here all day until you understand it. And I had a professor that told me, and this is so true about everything, he said, in life, everything should make sense. And so that's true of everything. I don't care what it is. Hair transplants, walking on the moon, playing the banjo, anything in life should make sense. So when you leave here, you should understand what the problem, the diagnosis is, what our treatment plan is, and why we suggested those methods. They should be crystal clear to you, and you should realize why we suggested X amount of grafts, because there's always a confusion when they come in. A person will say, this doctor said I need these amount of grafts, and so forth and so on, and a lot of times I have no idea how that number is attained in different offices. I know how it's done here, and I'm not saying what other people are doing are wrong, but all I can speak for is how we come up with our formula. So when you leave, you'll understand that, why we recommend what we do, if we recommend non-surgical therapy, and in every case, we're going to do what's best for you. It might not be the easiest because we have an FUE practice, so doing FUE is very time-consuming, but I wholeheartedly believe that's what's best for you because you do not get the scar in the back, and it gives you options. And a lot of patients will come in and say, well, my doctor said I need X amount of grafts, I'm going to have a strip and then have FUE after it. To me, that makes no sense. Why would you do it anyway? Because we can get as many grafts as you need every time. So there's no need to have a big surgery with a big cut and then get FUE in the scar. That's totally, to me, doesn't make any sense in my mind. So I think you should just have FUE from the beginning. So, I know I've said enough, but I want everybody to really understand what separates us. And we'd love to see you or discuss your individual hair problems. You can see us on the internet at DrYatesHairScience.com, or if you're in the Chicago area, please come by. This is Dr. Yates. Thank you.